questions today.
There's a record high number of new COVID cases. Are we going code red in Winnipeg? Is there any way to avoid going code red in the coming days?
I can't say today but I can tell you this, that the analysis is right now underway to determine what steps, if any, are necessary to additionally enhance what we're doing. It is clear from the numbers these last number of days that the cases continue to increase, primarily but not exclusively in Winnipeg. That causes the Chief Provincial Public Health Officer to surmise that what we are doing is not yet working to the extent that we would want it to. And so that discussion of what to do next is underway right now.
The strain on the healthcare system, 92% of ICU capacity, that's very telling. That, to me, that suggests, and talking to health experts, that suggests that action is needed very soon, not later.
And that is why we are taking action every single day, both in places where we know that spread is evident and across the system, bolstering capacity, adding resources, hiring workers. These are the things we're doing. Screening site enhancements, the launching of our appointment-based service that is helping thousands of people make appointments and then go to screening sites. All these things are having an effect, but as you say, the numbers are too high, so that is exactly the analysis that is underway right now to determine what steps are necessary to try to change the curve. We've always said that while the daily case numbers are significant, the real focus of epidemiology in all of these things is on areas of morbidity, mortality, and hospital capacity. And as you say, as we see more people coming into hospital, that is cause for concern, and that is why we then move to put into effect changes. I would want to make one thing very clear today, and that is that there are suggestions by the opposition leaders that we are near the brink because we are near capacity in our intensive care units. This is a misunderstanding of the way our healthcare system works. We have latent capacity distributed across our healthcare system, and at times like this, healthcare leaders and system leaders come together, and what they do is they determine how can we now redeploy workforce from across the system in order to focus on the most important thing. And that is the analysis that we've done. And so while you might say we're approaching capacity in ICU, yes, but we have the ability to flex up and add capacity.
Minister, yesterday and again today in the statement, Dr. Friesen advised, recommended Manitobans don't socialize with anyone outside the household. Will that become an order?
I won't speculate today on what Dr. Friesen will say tomorrow. We know that he will conduct his regular Friday afternoon or Friday noon briefing with media and Chief Nursing Officer Lynette Saragusa, and at that time there will be updates on what happens next.
So while you have that latent capacity, we do know that, as Dr. Friesen has said, there's a lag time between the cases and then the impacts on the healthcare system. With Christmas coming, can you describe how you may be running out of time to avoid a Christmas lockdown?
No, I won't speculate on that. I'll say that these numbers are concerning to all of us. We are seeing evidence right now of spread that is due to gatherings that took place at Thanksgiving. We have continued to see spread due to people not following the rules. The most important thing is right now we're at a crucial point in our response in this province. It is very important for people to be following those rules, to be doing the things that really matter. As Dr. Friesen stated the other day, if any Manitoban would think about getting a positive case result and not be able to simply say who they were principally in contact with over the last couple of days, that would be a problem. That's why the advice to not be socializing in the way you normally would. This is the time for all Manitobans to take this very seriously.
So tomorrow, announcing on Monday?
Tomorrow, Dr. Friesen will be updating all Manitobans as he always does on Friday. We will be, at that time, he will be obviously reflecting on the higher number of case positives. He will be reflecting on the increased demand in our healthcare system and on capacity issues. And we will, as always, defer to the public health chief, who will, as always, take an evidence-based approach to keep the safety of Manitobans first and foremost.
can you confirm we're not ever going to see the kind of lockdown we saw in April?
No one has a crystal ball. I think that what we've said as a government is that we have always tried to maneuver and to act and to plan so that we would not have to see a broad closure as we saw in the spring. We remain committed to trying to help create the conditions through our pandemic response system, through our district-based reporting, through the enhancement to capacity that we have been bringing to make sure we can still learn to live with COVID-19. But clearly, we are at a crossroads as a province. These numbers are not going in the right direction. We must take action to keep people safe. The analysis as to what those actions will include is underway right now.
Why are bars and restaurants
Last one
still
here, guys.
open at this point, given the high numbers and the ICU capacity?
I'm sure that the discussion about what is open and what might be curtailed or adjusted will all be on the menu for Dr. Friesen as he updates Manitobans tomorrow.
Thanks,
Just one more
everyone.
on that note, please.
Last one here. We got to get back to this.
What do you say to people who say, hey, look, Dr. Friesen just recommended my kid not have a play date outside the home, but somebody can go to a mall? What do you say to that?
Well, I think that's why there's an update coming tomorrow. You know, as you say, Bartley, fairness matters. And in all of these things, you know, you will recall in the spring how we increasingly, with those 4 levels of the pandemic response, we opened things up. Some things remain closed longer than others. And as we've been now clamping down at the advice of public health, we've been attempting to do so as well in that organized way. Right now, some people might say, I perceive an area of unfairness. We have in all these things, of course, tried to create an environment of fairness. And I'm sure that tomorrow, you know, we expect to see if there's changes to be made. It will be done with an attempt to keep things fair, but to keep things predominantly safe.
Thanks, everyone.